Hey everyone, and welcome. If you're grinding for the NEET-PG, INICET, or FMGE exams, you know every single mark can make or break your rank. So today, we're going to decode one of the most important and, honestly, one of the most rapidly changing topics in all of physiology, the baroreceptor reflex. Let's get into your game plan for 2026.
All right, let's cut right to the chase. If you are still preparing for simple, one-step, what is the baroreflex type questions, you're basically studying for an exam that doesn't exist anymore. Seriously, the game has totally changed. Simple recall is out, and deep, integrated reasoning is in.
So the real question is, are you ready for these new rules? Because this explainer is your key. We're going to break down exactly how these questions have shifted over time, and, more importantly, what you absolutely need to master to pull away from the crowd and land that top rank.
Okay, so first things first, let's go back in time. We've done a full-on forensic analysis of the last 5 years of PYQs, previous year's questions, to really map out the hidden pattern. Trust me, understanding where we've been is the best way to predict where we're going.
And just look at this timeline. It tells the whole story, doesn't it? We started with basic dynamic physiology. Then they threw in some simple drug interactions. After that, they added reflex blockades. Then they integrated it all with clinical shock. And finally, they hit us with super complex stuff like heart transplants. The trend is crystal clear. It's getting more clinical and way more complex every single year. So yeah, back in 2019, 2020, the big thing was the Valsalva maneuver. The examiners just wanted to know if you've got the basic dance between blood pressure and heart rate in phases 2 and 4. This was the foundation, right? Just pure, fundamental physiological reflexes.
Then, around 2021, pharmacology walks onto the stage. The classic question was about phenylephrine. You give a drug, it jacks up the blood pressure, and, predictably, the baroreflex kicks in and drops the heart rate. Super straightforward stuff, an easy point if you knew your basic drug-reflex connection.
Okay, now, this is where things started getting tricky and kind of fun. The examiners added a twist. What if you block the reflex? So you give phenylephrine to raise the BP, but you also give atropine, which blocks that vagal nerve. This is that classic afferent intact, efferent blocked logic. The signal gets to the brain just fine, but the command from the brain gets blocked. This is the kind of question that starts to separate the top performers. And then the big pivot, a massive shift toward real clinical reasoning. Suddenly, questions were embedding the baroreflex right into clinical scenarios: septic shock, neurogenic shock, hemorrhagic shock. All of a sudden, the reflex wasn't some abstract concept anymore. It was the bedrock for understanding how you manage a critically ill patient. This is 100% next-style thinking. And that brings us to the most recent evolution, the final boss, if you will, the heart transplant patient. Their heart has been surgically denervated. The nerves are cut. So what happens to the baroreflex? Absolutely nothing. The heart just can't respond. This question is just genius. It's neurophysiology, cardiology, and transplant surgery all wrapped up in one elegant concept.
All right, so that's the history lesson. Now for the really important part. Based on that evolution, let's build your playbook. These are the high-probability, must-know questions that you should be expecting in 2026. Prediction number 1, the integrated reflex block. I am telling you, this format is guaranteed high yield. That phenylephrine plus atropine scenario, it's going to be there in some form. Why? Because it tests the reflex and the pharmacology in one go. It instantly filters out anyone who just memorized the pathways without understanding them. Second, get ready for the controlled reflex. Examiners love this combination therapy kind of physiology. So imagine a patient on nitrates. Their BP is going to drop, which should trigger reflex tachycardia, right? But what if they're also on a beta blocker? Well, now that reflex is blunted. Your job is to predict the final outcome of that battle. Prediction 3 is another classic next-style clinical vignette. A patient gets high spinal anesthesia, and their blood pressure tanks. The baroreflex screams for sympathetic backup to raise the heart rate. But the anesthesia has blocked the sympathetic nerves leaving the spinal cord, so the heart rate never gets the message. See? The question isn't just what happens, it's why the reflex fails in that specific situation. And of course, the transplanted heart isn't going anywhere. It's just too good of a concept for examiners to pass up. It is such a clean, elegant way to check if you actually get the difference between the afferent and efferent limbs. The signal gets sent, but the phone line to the heart has been cut. The only thing that can change the heart rate now are those slower circulating hormones in the blood. Finally, let's talk about the Cushing reflex. We all know the triad: hypertension, bradycardia, weird breathing. But listen up, the 2026 level question won't just be about identifying the triad. It's going to ask for the mechanism. And here's the crucial insight you need: that bradycardia is not from the brainstem getting squished. It's the baroreflex firing like crazy because of that skyrocketing blood pressure. That's the money concept right there.
Okay, so let's boil all of this down into your winning blueprint. If there's one single thing you take away from this, it's that you have to shift your entire mindset from memorization to integration. I mean, just look at this. The difference is night and day. The old way was about simple, predictable facts. The new way is all about integrated, drug-modified clinical application. Your preparation has to change because the exam has already changed. So here's the bottom line. Mastery is no longer about knowing what the baroreflex is in a vacuum. It's about connecting the dots. You have to be able to fluidly link that core reflex to pharmacology, to autonomic blockades, and to real-world clinical states like shock or what happens after a transplant. I want to leave you with this one thought. For these upcoming exams, it is no longer about just what you know. It is all about how you connect what you know. Apply that integrated thinking across everything you study, and you will have that competitive edge you're looking for. Now go out there and crush it.